There's a lot to feel great about being Australian, like our spirit of mateship and making the most of the many opportunities we're given. We're known for our courage and resilience and our passion. Most importantly, we believe in the idea of a fair go. Not just having one, but also giving one in return. We are vibrant and distinct as one of the most diverse societies in the world. While our stories may begin in different places, we're bonded by a common future that we will create together. So look around. It's easy to find inspiration to participate in your Australian citizenship. That means getting out there, being part of the community, and helping to create a sense of belonging. When every single one of us are just that little bit inspired to get involved, together as Australians, we can be truly inspiring.
Welcome to another of our Inspiring Australians Lunch with Leaders. My name's Morgan. I'm the CEO here at Auspire, and I am absolutely pleased to be your MC today, even though I have not started it in a great way, a bit of a tech fail, and we'll work on that so that we can get that organised. I want to welcome everyone joining us today from around Australia. I know we've got a few people coming in from different parts of the country, but I'm actually here in Whadjuk Noongar country, so close to the beautiful banks of the Swan River, which is the Derbarl Yerrigan. That's the Noongar name for the Swan River. And I am really, really pleased to say that we're here in this very special place of the Whadjuk Noongar people, who are the traditional custodians of this wonderful land. And I pay my respects to their elders, past and present, and especially to those of you who may be joining us online today. Now, we do have a little bit of housekeeping before we get started. You are all joining us with your cameras and your audio off. We're using the webinar function. So please do note that if you do have a bit of a reason to contact us at any time, please use the chat function and a member of the Auspire team can assist you on that. We will have time for questions at the end, and we're looking forward to having that discussion with our speakers in a Q&A at the end. So please, again, use the chat function to pose your questions, and the Auspire team will curate those questions and we will feed those through to our guest speakers. I do also want to say right now we have a trigger warning. We do have some content today that may be distressing for some of our guests that are joining us online. So if any of the discussion triggers any issues or trauma for you, please know that support is available 24/7 at beyondblue.org.au, or you can call 1300 22 46 36. The session is being recorded today, so we will also be able to make that recording available on our channels in the next day or so. So if you do miss any of it, you will be able to go back and find that. So I do think we're good to go. I am still trying to work out the technical side, my technical side, so forgive me if it's a little bit disjointed. But we are all here today, as you're well aware, to talk to WA 2023 Australian of the Year Professor Samar Aoun, who has been recognised for her advocacy and impact on the public health approaches to end-of-life care. Now, Samar has been recognised globally for her work, her leading palliative care research, and she has a very long list of amazing things she's achieved, but I don't have time to go through all of it. But right now, I guess what is important is, particularly for today's content we will be discussing, is that Samar is one of the co-founders of the Southwest Compassionate Communities Network. She is the Parent Institute Research Chair in Palliative Care. She is president of Motor Neuron Disease Association here in WA, and she's also a director on the Motor Neuron Disease Australia Board. So welcome, Samar. Thank you so much for making the time today to speak to us all. Ladies and gentlemen who are visiting us online, please welcome Dr. Samar Aoun. So we are also very pleased to have with us, joining us from the Eastern States, Jessie Williams. Jessie, thank you. Jessie's the campaign manager of Dying to Know You Day, which is an annual campaign during August that empowers adults and Australians to be strong self-advocates for their own personal planning when it comes to their future and, importantly, their end of life. So during August, people are encouraged to improve their knowledge around those choices for their end of life and end of life care. So great to have you as well with us, Jessie. Thank you.
Thanks, Morgan.
Now, the format for today's Lunch with Leaders will include a presentation from each of you, and then we are going to have our Q&A. So please, everyone that's joining us, please do start thinking about some of those questions. We will start with Jessie, and I think, Jessie, great to set the tone and the scene about Dying to Know Day, which will then set us up beautifully for all the amazing content that we will hear from Professor Aoun after you. So Jessie, let's go. Step us through the impetus of Dying to Know Day.
Thank you so much, Morgan. And firstly, I want to acknowledge country and acknowledge that IT problems come with modern life these days, don't they? So it's all good. So as Morgan said, I'm dialing in from the eastern states. So I want to acknowledge that I'm dialing in from Gadigal land, and in particular Camaragal land. I acknowledge that I live on land that crosses over unceded First Nations country. I want to pay my respects and give thanks to the ancestors, elders, and young people of the Camaragal land for their nurturing, protection, and caregiving of these sacred lands and waterways. I acknowledge their continuation of cultural, spiritual, and educational practices. So here's my pitch. People plan for months for a birth. Why not for a death? So overwhelmingly, the majority of Australians think that end-of-life planning is really important. 87% of Australians think it's really important. But most of us will experience barriers to taking action. So this is why we decided to establish a health promotion campaign. So some of those challenges that Australians face when thinking about end-of-life planning is, well, there's three that we think are notable. One is that death and dying is too emotional to talk about. I mean, it's kind of understandable, isn't it? Like, life is for the living. We've got one life to live. Who wants to think about that other part? The second barrier is just actually not knowing where to start or where to get help or find information. If you go online these days and you start Googling end-of-life planning, you get a whole lot of sources of information, some of which have terms that you've probably never even heard of before. So where on earth do you start with that? And thirdly, just not understanding the choices that are available to us. You know, dying has changed over the years. The things that we die from and the period of life that we have when we're living with chronic illness, those things have changed. So we actually do have more choices than we've had before, but we're not necessarily educated about those choices. So we started Dying to Know Day as a way to really crack through some of those challenges and really inspire Australians to think about death in a different way, and certainly think about it when we're well, not when we're stressed, not when we're in grief, not when we're sad or overwhelmed. So I just want to show you a couple of little images here. It was actually based on a book called Dying to Know, which was curated by a wonderful organisation called Igniting Change. Igniting Change are a social change organisation down in Melbourne. And this is a coffee table book. And it's been, you know, there's thousands of copies out there. Generally palliative care, the palliative care industry have been the first adopters of this book, but anyone can buy it online. And if you just flick through it, there are wonderful images and words from different cultures and practices across the country that really help us to think about death in a different way. So the Dying to Know campaign is a uniquely Australian campaign. It's grassroots. What I mean by that is the people who participate in it are from all communities and all walks of life and all agencies. So this year, our campaign poster is to get dead set. We thought that had a nice ring to it. It's a bit of ocarism, I guess, in there. And you'll notice that there's a man and a woman running into the surf, strong currents ahead, but they don't look scared or miserable. There's kind of energy in there. And that's the thing about thinking and planning about end of life. It's daunting at first, but when you start to get into it and understand the options that are available, you can actually have a laugh, you can find the humor in it, and you actually can be inspired by it. So we launch the campaign every year with a poster and a call to action, and then we basically just sit back and see what events are going to be registered. So this year so far, we've got about 160 events happening across the country for the month of August, and there are some amazing ones happening in WA, which Samar is going to share in her presentation. But I wanted to just give you just a little bit of a taster, and it was very hard to choose which ones I was going to share. So over to the left, we actually have New Zealand involved. Being a Kiwi myself, that's very cool. This is what's called a death over dinner. Death over a dinner is generally the rule is if you're going to talk about this topic, you really need food and maybe even wine or cups of tea involved. So death over dinner is like a dinner party with one topic. Over to the right, we've got the Before I Die wall. So this is a public art installation. There's been over 5,000 of them across the country, across the world, sorry. This is an international thing, and anyone can download the instructions for how to set up a Before I Die wall. This has actually been put on by a hospice, which is really wonderful to see hospices actually getting out there and engaging with their community. Down the bottom, grave affairs. Now this is a bit edgy. It's a bit, you know, it's not everyone's cup of tea, but it's some people's cup of tea. And this is what's great about the campaign. We never really know what's going to happen. But it's put on by the Greater Metropolitan Cemeteries Trust in Victoria. And they're bringing a whole lot diverse group of people who have got their death literacy, who have got information to share to really engage with the community there. And then the Dead Set Expo, which we love the title of that, in Walkerville Council, South Australia. So the campaign has got a lot of participation from a lot of different places. So there are a number of online events. So wherever you are in Australia, you can get involved if there's not a face-to-face community event in your community. So it's very much about cross-sector collaboration. I think this is the thing that makes us so proud of the campaign. It's really a time where local councils, palliative care, end-of-life educators and community members can come together. Some of these events are put on by government. And as I said, some of these events are put on just by community members. And there's not a lot of other excuses I think we can find to really come together with that diversity to talk about this topic. I think the reason why this campaign has worked so well, I always forget the number. I think we're in year 9 now, year 10. I'll put it in the chat later. Is that, you know, no one gets out of this thing alive, right, Samar? Like death, caring for our dying, caring for ourselves, caring for our loved ones, it takes all of us. And so this is really a campaign that is there for everybody. Historically, over 950 events have taken place that's really hard to say, since inception. There you go, I got it out. Look, I just wanted to make one or two more points. Firstly, I often get asked, like, why is it so hard to talk about this topic? You know, is this topic taboo? My response to that question is, it's not taboo. It's difficult and challenging, but it's not taboo. We can list things that are taboo to talk about. But it is difficult to talk about it openly because it sits in a historical context. And when I say that, what I mean particularly is in the westernized culture. In the West, we are a death-denying culture. So we do not like to think about, talk about, or acknowledge death as an inevitable reality of being alive. And partly what's to blame there is the history of how we've outsourced the care of our dying to hospitals and to nursing homes. And thank goodness we have good care. No one's bemoaning that. It's just that it's come at a bit of a cost. It's come at a cost to our death literacy. So death literacy is really just about the practical knowledge and know-how about how to talk about this topic and how to care for each other. So Dying to Know Day is an opportunity for people to build their death literacy. And I promise you, if you build it a little bit, you'll want to build it more. It's like a little bit of knowledge is not a dangerous thing. It's a good thing when it comes to end of life. So it's an independent campaign. It is not funded by any source. It's funded by us in my organisation, but the participation and the muscle comes from the people who run the events. So in Australia, every 3 minutes someone dies, and every 3 minutes there's an opportunity for more love, more resolution, more comfort, more care, more knowledge. So I just encourage everybody to get involved in the campaign. I know it kicks off next week. It does come around every year. So if you want to get involved next year and have more time to think about how you'd like to do that, please just drop me a line. And Morgan, thank you so much for highlighting this campaign and allowing us to speak alongside the amazing Samar. So thank you so much.
You're more than welcome. And hey, it's not me that's highlighted the campaign. I think it's because of the work that we were introduced to by meeting the amazing Samar, and of course having this session this week with Dying to Know Day on the 8th of August. It's perfect. It was perfect timing to put a spotlight on this. So thank you, Jessie. We really appreciate you being with us today and sharing the details about the program. And to those of our viewers that are joining us, if you are interested in doing an event, we will put a link into the chat for access to some of the toolkits and the resources so that you can you look into that and do something to promote this really important message. So it is now my great pleasure to invite the WA 2023 Australian of the Year, Professor Samar Aoun, to speak about her research into palliative care and, of course, the Compassionate Communities program. Now, I will flag that Samar has some really great content here, and we have got lots that we want to cover with you all. So it is worth letting you know that Samar has really kindly agreed to provide access to the slides after the event. So make sure that you lean in and you take it all in, and don't worry about taking notes or screenshots, because we will give access to the content at the end. So Samar, it's over to you. Everyone strap in and get ready. This is going to be really great. Thanks, Samar.
Thanks a lot, Morgan, and thanks for this amazing opportunity today to talk about a difficult subject. You are really contributing to making it less difficult by having these opportunities. And of course, thank you for the opportunity to be WA Australian of the Year. This has been an amazing platform everywhere we've been to break those taboos. So yeah, thanks for everybody. As Jessie said, it's everyone needs to be in it and everyone can help in it. And Jessie's introduction has been amazing. So thank you, Jessie. So, you know, from all the conversations I had with people, they keep asking, so what can we do? And will it work? And of course, being a researcher, I was hell-bent on proving that it works because it makes sense, but it's not a lovey-dovey approach to, improving things. It does work. So that's why I call this presentation really, We Only Die Once, Let's Make It a Good One. And I've mentioned this at the award time, but from evidence to practice, and this is what really matters now, is to be able to, let people walk them through this journey with us. So you may have seen this, we only live once, but really it's wrong. We only die once, and we live every day. And while we're living every day, we have a job to do. We really need to work on how we can die once, but really have a good death. So what is compassionate communities? It's not only an aspiration, it really is a practice. It's inclusive, it doesn't matter what disease people have, it's about suffering. It's committed to system change, and that's exactly what we want to prove, that it does work and change systems. And I'll talk a little bit about that later. And it's a key element of a public health palliative care approach. And that means that the community is an equal partner. The community was an equal partner for a long time. Unfortunately, the community has been de-skilled over the years, particularly in the Western culture. So internationally now, models of social and practical support at the end of life are gaining momentum because of this movement. And what it requires is a shift in the culture of care and support, where care can become more sustainable and affordable. And we need high levels of community control and ownership. So what is the evidence behind this? Now, only 5% of people who illness and dying really are in touch with a health professional, whether doctor, nurse practitioner. And you may have thought it's more than this, but it's not. So who are the 95% that are in our lives? And that's all of us, the spouse, the friends, the families, the neighbors, where we work, everybody. what have we done to those 95%? I mean, these are our assets in the communities that, we really need to bring back, because they have delivered good support throughout, the decades. And this is where we need to get them back in the picture. So one of the empirical evidence that the compassionate communities approach to care works is when we did this national survey in Australia that has really changed people are viewing now bereavement care. When we ask people who actually helped you when you lost someone, as you can see, 90% family, friends, 80% even funeral providers, and then it goes down. And as you can see, the counselors, the health professionals are in the 10% category. Then you have people in the community who are not necessarily specialists in bereavement support, but you chat to a pharmacist, you tell them about your woes, they have a nice word to say, and so on. And then the informal, where basically we have the majority of people who have been helped by family, friends, and funeral provider. So this is the public health model for bereavement support that's come out of that survey, where it shows that only 60% of people would be at risk of developing complicated grief. That's the low risk. And then 30% would need more help, but not professional support, more help from us as peer leaders, as volunteers who are a bit more trained to help people reflect on their loss. And then only 10% needs to go to mental health professionals. That's really been resonated well all over the world, and made sense for resource allocation, because before that, bereavement care became too pathologized and medicalized, and people thought, well, every time you have a death, you really need to see a counselor. That's not what people are saying. Now, when we ask people how helpful was this, and as you can see, the blue line is where it was really very or quite helpful. Again, family, friends, and funeral provider topped the list in terms of where people felt they had really good support, and more of the red and not helpful was sort of more in also the professional people right at the bottom. So when we talk about grief, does it ever go? It doesn't really. People think that grief slowly gets smaller with time. But in reality, grief stays the same size, but slowly life begins to grow bigger around it. And that blank around that red circle, this is where the community comes in and wraps around the people who are grieving to help them through that journey. So the number of Australians dying will double in the next 25 years. Now, this is important to take stock of, because we really need a good intervention to start happening. We can't wait till this happens. All the baby boomers are going to die at the same time, kind of thing. And again, another report showed that many Australians are saying they're not dying in a place and in a way that reflects their values or their choices. But have we ever discussed our values and our choices? This is the key point here. And so they end up going to hospital quite a lot towards the end of life care. And that really robs them from dignity and control that they want over their life. So the Professor Alan Carr, who started this movement, he said that death is a social event with a medical component. It is not a medical event with a social component. That really made the difference for me into understanding how we carry on with the journey. And then I elaborated on this in one of the opinion editorials in the West during Palliative Care Week, where, it won't kill us to speak openly about death and dying. It's not a disease that you're going to get the following day and die from if you talk about death. So how are we doing in Australia? Now, the latest Australian Institute Health and Welfare, they said that, in the last 5 years, there has been 23% increase in the number of palliative care related hospitalizations, compared to only 12% increase from all hospitalizations. So again, we haven't really got this right. And then 65% of those palliative care hospitalization ended up with the patient in hospital. Now, spending on key health services is 14 times higher for Australians in the last year of their life. And we know that, hospital is 3 times the cost of community palliative care. 70 to 80% of us want to die at home, but only 14 to 20% do. And you've seen the latest statistics. 75% of Australians haven't had end-of-life discussions. And less than 10% of us die with an advanced care directives. And there's been a lot of funding that's gone on advanced care planning, but still the uptake is quite low. The next thing that's going to be the biggest killer for our society, anywhere in the Western world, is social isolation. And again, we have a lot of people who are really socially disconnected and lonely towards the end of life. So social connectedness impact cannot be overlooked. It is a health determinant, both physical and mental. And a lot of trials have showed that people who are more socially connected are happier, physically healthier, live longer, even if they have limiting illnesses. So this is again another trial that showed that social relationships, strong social relationships, have got a better impact on reducing mortality than if you stopped smoking or reduced your blood pressure or started exercising. So a lot of people are amazed when they hear this evidence that's happening all around the world. Then we looked at, okay, what are the benefits of a compassionate community when we kind of start organizing ourselves that way? It's about building resilient networks of support about families in need, skilling up caring networks, increasing neighborhood capacity to care for those who experience death, dying, and loss, integrating and building trusting relationships between between the community and health and social care teams. And I've got an example on this, how it's worked. Increasing equity of services, and then financial savings. And of course, the UK showed that, and we were able to show this here as well. So we started with our Southwest Compassionate Communities Network, where our aim was that every person, every family, every community knows what to do when someone is caring, dying, or grieving. This is a lovely group of the first connectors that, what we call them compassionate community connectors. They are volunteers who their role specifically is to enhance the networks around families in need. They would actually go in, ask the families, what are your needs? Who is your network? Are they able to help you? If you can't ask them, I'll do that asking for you. So what they do, they reach out in the community and ask caring helpers there, who could be anybody in the community, not necessarily related to the family. And what people with life-limiting illness and dying really want to normalize the way they are living until they die. So they still want walking the dog, doing the shopping, collecting prescription, and sitting with them and having a chat. I mean, they are craving for this. So there are little things that but enormous impact on people. So our community volunteers are trained to diagnose suffering, not diseases. Now, these are the range of domains where the volunteers were helping the families. And as you can see, the red one, this is where the most need was. 76.9% wanted social help. And so these are some of the ways our volunteers help in terms of getting people to visit, to help people with wills, advanced health directives, equipment access, meal delivery, house cleaning, joining community groups, surrogate grannies for family with kids, transport, gardening, social visits. And the most important one is really empowerment and ownership. You can do this because these people, being so socially isolated with a life-limiting illness, have totally dropped the bundle. So within those circles of cares where we are all in, around the person with illness and family carer, only 26% of the sources were naturally occurring networks. That means fast people. And the rest, the majority, were facilitated networks that the connectors were so resourceful and were trying to find people from the community to help. And people want to help, but they don't know how. And the first thing we can start with is people who need help is by asking for help. We've lost the skill to ask for help. Ask anybody, no matter what situation they're in. How are you today? Do you need any help? No, I'm fine, thank you. Now, what happens is that the person with the illness will shut all networks around them if they say, no, we don't need help. The other important point is that they are doing a favor for their communities to skilling them in offering that help. Because if they don't open their doors for people to help them, we don't have a skilled community to practice, basically, and know how to provide help. Now, about 50% of those families who were referred to this program from palliative care and chronic disease care teams of the WA Country Health Service were home alone. They had families, but they were socially disconnected. So we looked at increasing their social connectedness by using a validated tool. As you can see, the blue bars is where the increase has happened when we had the intervention. Again, with this one, we looked at the availability of social support before and after the intervention. As you can see, the blue bar, we've doubled the social networks around those families. When we asked, the families themselves, where was the highest impact, by having the connectors and the caring helpers help you? Again, in reducing social isolation, in coping with daily activities. We asked the same question for the connectors themselves. They were too humble. They had no idea that the impact was so great on families. So they kind of rated themselves a lot less than what the families have rated them. This is a picture of how a family started with this program. These are the people around that, the family in need. And when the connectors and the caring helpers came, there was a whole buzz of activities and connectedness between family, community, friends, formal services to improve the care of this person. Because not only quality of care improved, but quality of life and quality of death. So these are the key outcomes of the effectiveness analysis. There was significant decline in frequency of hospitalization, significant decline in the number of hospital days, and increased use of outpatient services. The reason being, some of these patients used to freak out on the weekend or after hours when there's no one to help them, or formal services, it's after hours for them. But once they started having those volunteers in their own circles, they're able to call them, they came to them, sort of worked through their anxiousness and concern, and so they didn't have to go to the hospital. Again, if they did go to the hospital, they didn't want to stay more than it's needed because they have now people in the community who love them, care for them, so they're really keen to just get out as soon as possible. Again, connectors and volunteers have helped increase the use of outpatient services and community-based services because they were helping making those appointments for these families and also transporting them there. So that's an amazing win-win situation. So overall, over a 6 month period, the net saving for the health service was just over $500,000. So what did the patients say? Because you're going to have all the slides, I just won't read everything, but the patients loved it. They felt so much being connected again, and the actual volunteers have made so much difference to their life. It's pretty amazing from what they said as a sort of an overall thing. This is like one picture of a caring lady with COPD do some home card, some card making at home. What did the healthcare services say? Amazing. These are the people who were in the too hard basket, and they couldn't really get to them, in a way that they could help them, particularly if they are socially isolated. So again, they felt it was another string to their bow, especially in small rural areas where there's a lack of those services. Easy to implement, and this is what we want to hear. For a partnership, we need to provide something that's easy to implement. The connectors themselves loved it, and the main sort of quote that stuck is the last one. The more you give, the better the reward. The reward is greater than the effort. That's absolutely what these connectors and volunteers felt about their contribution. So where to from here? The red ones is what we've been able to achieve. It's a system change. So the health service integrated the program as standard practice within their chronic disease team. And that's amazing. That's a really quick translation into practice. Usually translation takes years after we prove that it works. The second one is, how can we get that vision to all the community now? I mean, we started with a small group, we tested it, it works. And there was no other way of doing it except getting a charter for the whole community. And it's called, we'll call it Compassionate Bunbury Charter. A lot of cities in the world have gone to that level of working with local government, because local government is the closest level of government to the communities. So what's the practice? What can we do? So start with a city charter, town charter, whatever you are, because this will guide and encourage your community to be more resilient, responsive, and understands the need for community support to get through difficult times. We went one step further, whereby we have another document called the toolkit. And it lets the community know these are the set of actions that you can do to give them some ideas. And also we ask them to pledge, okay, in the next 6 months, what is it you want to do personally within your community, within your workplace to make things better for everyone? These are the 10 aspects that come from community consultations to grow community, but that could really be growing compassion really anywhere. It's based on the literature, on consultations, on communities. And we're working now through these 10 aspects to bolster compassion in every aspect of our life. Now, the charter is based on the principles of the Ottawa Charter for Health Promotion. It's about building health public policy, creating supportive environments, strengthening community action, developing personal skills, and reorienting healthcare services. So certainly we've been able to achieve all that through the Compassionate Connectors program, but there's more to do. So why we need a charter? It's a systematic way of ensuring we build compassionate communities in all sectors: educational institutions, workplaces, religious institutions, neighborhood, homeless, vulnerable, amongst others. It's incentive schemes and awards at the civic level. We need practical expressions of compassion, and our mayor in Bunbury to see if we could have an award once a year for the best compassionate act or the best compassionate workplace. So it's work in action. So it is a concise way of organizing a purposeful program of civic action oriented towards end-of-life care. So it's never happened before, it's happening now, and I encourage everyone to take a closer look. So this is when the Bunbury City Council endorsed the toolkit and the charter, and we're having a launch for the community on the 4th of August. When I look at this photo, it reminds me how old I am, because the mayor is the age of my son. So anyway, it's good reminder. So what can we do as a community to improve death literacy and grief literacy? As Jessie very eloquently mentioned, this is their campaign this year about Get Dead Set. And we have a program in Bunbury and the Southwest, how we're going to do things. But let me take you through what we've done previously, and we're still doing this. Death cafes are a really great way for education and awareness in this field. I encourage you to attend. They're all over Australia, basically now. We started with a death festival in Bunbury in 2018, and the co-founder of the Southwest Compassion Community Network, Dr. Julianne Hilbers, led this whole thing. We had a coffin that we were painting, which again was like something wow for the community, but it's more really to make things visible. Then we had a youth art competition at schools where kids basically talked about, you know, the life cycle and how, you know, death comes apart, whether in biology or their own families. We had a forum on building connectedness, again, at the Bunbury Regional Entertainment Centre. Again, it was very well ended. In 2022, we had Opening the Door to Death, whereby we're encouraging families not to shield their children from conversations about death and dying, because it's part of life. And then the connectors there, the three lovely people there, how they've reduced social isolations on families. Palliative Care Australia had an amazing film this year, Live the Life You Please. So again, that was a really good conversation after that to talk about death, dying, grief and loss. So I encourage everybody to get hold of this movie and play it. What we're going to have this year as well is remembering the dead by having floating lanterns in the lake of the Bunbury Cemetery. This is the lantern that I've written myself when I was in Bruges last year for International Compassionate Communities Conference. And it's got the name of Cherie and as well all my other. And today is Cherie's birthday. And if her mum, Rita, is here listening, I feel for your pain today, but it's a great day to basically share this with everybody, Rita. Concert in the cemetery, we're planning for this, so it's going to be really great as well. We ran a workshop on compassionate workplaces attended by many corporate and businesses, and it was supported by the Bunbury Chamber of Commerce and also the Southwest Development Commission. So more and more organizations are embracing this and coming to work with us, which is fantastic. So the final outcome, really, we need to ensure that when caregiving, dying, and grieving, not at our door, wherever we are and whoever we are, that compassionate support will be found in all aspects of our lives and death. And we can do it, people. Supporting those caring, dying, and grieving is absolutely everybody's responsibility. Thank you.
Thank you so much, Samar. There is just so much in there, but I have to say, I think it is perfectly summed up by that very first slide with the two people sitting on the rocks. And the one person says, oh, you know, you've only got, you know, you only live once. And the other guy said, no, that's not true. We only die once. You live life every day. It really does bring that home. It does sort of unsettle to rethink about the role that we all need to play towards this, I guess, the journey towards the inevitable, right? So thank you so much. Absolutely brilliant content. And thank you for letting us make that available to the people that are joining us. So that's terrific. I do want to start getting to some questions. We do have a few that are coming through. So I guess the first one that I would like to ask, and yeah, great, we've got Jessie back too. The first one I would like to ask, and it goes back, Samar, I'm going to throw this one to you because it's to do with the to the connectors, and it's about how someone can become a connector in their own community, and you know what's officially involved. Is there an official network that they have to sign up to? Is there training? Can you just step us through sort of that process of signing up and becoming a connector and the step of that?
Yeah, certainly. I'll tell you how we're doing this stuff with, but of course, Jessie is also doing something similar in the Eastern States. So what we do, we had a call for the community who would want to be a connector, explaining what a connector does from the slides that you've seen. And then we bring them through a 1 day of training. And the interesting thing about that, people can decide for themselves if this is for them or not. But at least we have built the capacity of the community in general. If they don't want to be part of a program, they can do it themselves in their own communities. So knowledge is powerful anyway. And so the ones who prefer to stay in a program, they said, look, they do this anyway themselves, you know, but they were feeling too isolated. It's being part of a community of practice that we're really, you know, interested in. And we kept in touch with them, and we're still doing this now every 2 weeks. But we listen to them. We hear from them how they're doing things with communities and with their families. We are learning from them all the time. So it's very much of an organic way, the way you help your community. It doesn't have boundaries in terms of how many hours, how many days, how many. If you have your neighbor who needs your support, whenever you can offer it, you do. If you have a trip, you go, you come back, check on them, or make sure someone in your absence can check on them. And this is, I think, why the attraction to this kind of model of volunteering, which is different from the traditional way of volunteering, whereby they have to lock into certain days, times, you know, all time, come back and report to the health service. What they told us, this is a fresh way of connecting with our communities. And we have more agency, we have more autonomy than the way we have done volunteering before, because some of them have done different kinds of volunteering before coming to the Connected program. And so health professionals refer through a coordinator of Connector. This is the only paid position. And the coordinator of Connector screens the patients to see if they are suitable for the program and matches the patients to the connectors. And so far, I must say, it's been amazing. The rapport that was built between the connectors and families have worked most of the time. So this is briefly how things work. Yeah.
Thank you. And that's great. So if anyone wants to get involved, we'll give you the link so that you can get to the right place. Jessie, can I ask you a question about the process, and I guess the work around dying to know and understanding, you know, wills and enduring powers of guardianship and all that sort of end of life planning. Is that the same across the whole of Australia, or is every state and territory different?
Yeah, every state and territory is different. So this is where I say I am not a lawyer, but I do know the pain points of the Australian public. And also, you know, many of our loved ones, our parents, our aunties, uncles, grandparents live in different states. So even if we're deaf literate in New South Wales, we're not necessarily deaf literate in Western Australia. So yeah, on the Dying to Know Day website, we've done our best to demystify some of that information with that documentation by talking about what some of the names of the different documents are by state. But even we found it quite a daunting task as a, you know, small social change organization. So yeah, so I think when, you know, this is why, you know, I think people like to collectivize their knowledge, because when we gather in a room and we talk about this, there's always someone in the crowd who'll say, oh, no, that's an advanced care directive, not a power of attorney, and you've got to do it like this and do it like that. And that's where I think the hunger is coming from the Australian public, is to, because we use normal language, you know. We sometimes when we meet with professionals, they use lingo, so we try to break it down a little bit. But simply put, yes, it's a bit of a minefield out there.
Morgan, can I just add to Jessie? So, you know, all these things about advanced care planning campaigns, very important. But in a lot of the times, they're falling on a deaf illiterate community. It's a lot to do when you're asking somebody who's never had conversations all their life about death, dying, grief, and loss. They haven't quite reflected on their values and their choices, to come and give them a complicated form and say, right, fill it now. What treatment you want, you don't want, when do you want to die, you know? So, and this is what I'm calling for this year, is we really need a campaign for death literacy and grief literacy nationally for everyone, because we really need ground so well now and reskill our community the way it was, I don't know, 60 years ago, maybe, you know, to actually own this. And then we can bring in programs like advanced care planning, I'm not saying that they shouldn't carry on, because, you know, we've got them now, but it's just we put the cart before the horse. And that's where I want, you know, everybody, call to government, call to anybody, that we really need to start by preparing the grounds, preparing our community to be more death literate and grief literate.
It leads to the question actually that's come through from Graham, and that do we ensure that collaboration between the medical community, the government, and the general population to ensure that that is happening, and this death literacy piece is rolling out. You know, you guys, you're a volunteer-led, relying on volunteers organisation. How is there a way? Is there a framework? Is there something that you've started to think about, other than obviously what you've been doing down in the Southwest with the charter? And that's a really great start, and congratulations with the launch coming up in a few days' time. Is there a way, have you been thinking about how to get the medical community, the government, and the general population to come together and work out a solution so that we can start to solve the death literacy issue that is obviously a nationwide piece, not just a West Australian or a Bunbury piece?
I totally agree. Look, it started from being an international movement. It's just how to operationalize it in the Southwest. And the idea today is give an example. So following from that, I've got now invitations from several local government to present to them. Done the town of Cambridge. I've got City of Vincent coming up. Joondalup are very interested, like sort of here. Again, a lot of health services are interested. How can we start doing this in the metro area? Because obviously we tried it in the regional area, not just in WA, even, you know, nationwide. So there is, and I think I'm really happy to have this platform, or as Jessie called, megaphone this year, so that I was able to start getting the message out there, and it's getting there. So now, how can we work together on really start operationalizing health service in every community? Because it's, again, you know, it's not just partnership with health services, it's partnership with local governments, partnership with schools, workplaces. There's so much there that we need to do. So I'm glad in the small time we've been operating, I've touched on a few examples just to give people an idea for now.
What about multicultural communities? And in fact, but question for both of you. One of you, obviously, Jessie, you're working in the campaign space, getting materials out there to help communities understand what they can and get involved in and promote and get the cause sort of moving, and get some champions in each individual workplaces with those materials and toolkits that you've created. And Samar, you're at the coalface, you see the research, you know the sorts of communities, particularly the more vulnerable communities that are affected by this. How are we working and helping and supporting our multicultural communities? Are there modes of delivery or ways that we have to do it differently to be culturally more sensitive or, you know, language diverse? Maybe each of you can maybe respond to that.
Sure, I'm happy to jump in. I think it's a really great question. We are, as you say, a culture, we are a society with many cultures in it, and we're all Australian. We bring our rituals and our practices and our norms from these other cultures from other countries to Australia, and yet we don't celebrate those norms. We do, for example, for Harmony Day, where we might celebrate our food, but what if we just tweaked Harmony Day a little bit and said, let's actually talk about the rituals that we have around honouring our dead, dealing with death, dealing with grief from other countries. I know through the work that we do in the campaign, our way of doing that is to encourage people to share their story. When you're having these community gatherings, you know, share your story. I remember we had an event in a nursing home where there were a lot of, you know, Anglo residents and a lot of nurses and carers from the Pacific Islands, and no one had asked them, so how do you care for your dying in your communities? And they say, yeah, it's really weird when you come to Australia, you know, we care for each other in our families and our home, you know, home residents, but here it's kind of different. So bringing out the stories is really, really important. I think that there's in the government systems in terms of health information, it's not so bad in terms of translation in different languages and fact sheets. But we're talking about the power of community knowledge here and how that gets shared. I think that's about story. We did a wonderful partnership with Diversity Council of Australia last week, talking about bereavement support in the workplace. And so even partnering with national diversity and inclusion organisations is something that we want to do more of in the future.
Samar, from your point of view, the culturally inclusive way that we can deliver and support these programs, are there any specific learnings or insights that you can add?
Well, I guess I'm one of those multicultural. So I can really talk. Yeah, I tick another box. You know, again, as Jessie said, we have a wealth of ways of how we support each other, and that was really came close to me when my dad died in 2012, and I was rushing to chair a research meeting in my old workplace. So I rang the office to say, I'm going to be late, my dad died, I need to book my ticket because they don't wait to bury our dead, so I really need to go quickly. Anyway, I book my ticket, I go to the office, I walk into the research meeting. There were about 8 health professionals there, all my colleagues, and no one said anything to me. No one acknowledged that acute pain I was under. Well, we know why. They just didn't know what to say, even though they are health professionals. It's not like they didn't care. The following day, I was on the plane. I got to Lebanon, where originally I came from, and just the amount of community support, it was surreal. Like I felt I was carried on a cloud of love. For 3 days, we had morning in the church hall. We ate together. We cried together. We laughed together. It was an amazing feeling. I just felt in 3 days my acute grief was kind of resolved. I can go back now to Australia and carry on with. But on the way, on the plane, which is a long time to be on the plane, I thought, this is it. You know, dying, grief, and loss belong to the community. They do it really well. So our multicultural communities, they are still doing it well here. You know, they do have their support system. They know how to reach out. They know how to get those links together and nurture them, because it is how they've done it back home. They're still doing it here, and we need to support this, Morgan. This is what I'm saying, getting to. So it's and then one of the things, say, the Southwest Compassion Community Network have got grants for now is for a cooling blanket, whereby we're helping the cultures who want to have their loved one stay at home for a few days and not be rushed, you know, to the funeral provider. They can put the body in this cooling blanket for 3 days and then do whatever their ways of saying goodbye, because that showed it helps a lot with the bereavement process. So this is, again, one example. We're trying to help, say, people from other cultures who are used to their dead at home for a few days, not straight from the hospital to, the cemetery. So we need to learn from them, as Jessie said. They've got amazing ways of honoring their dead, and which basically help them as well. And I think, again, with those compassionate communities movement, once we have them everywhere, multicultural people need to be part of this and give us ideas how we do it, basically, and how we need to do it in the Western culture. The latest article I've written with my amazing colleagues, Professor Alan Kelleher and Dr. Julian Abel, is called Bereave and Care Reimagined. And one of the reviewers asked for us, so why are you talking about the Western culture all the time? What about everyone else in the world? And of course, one of the other co-authors said, hands off, they do it well. This is for you guys in the Western culture. We need to do it like they do it. So that was amazing.
It is so true. We learn so much from the different ways that different cultures do things, and we know now about how amazing it is when we listen to our First Nations people and how they do things. And so, yes, it's us Anglos that need to get our acts together. Look, I think we've got time for one more question, and I'm going to get this one straight from the Q&A. It's from Jill. Thank you, Jill. And there are thank you so much to others that have thrown messages up into the chat. We will make sure that our speakers get all of your fabulous feedback, telling them what a wonderful job they're doing. So thank you for everyone for your beautiful contributions today. But one more question, and I'll let you both decide who wants to answer it, because I think it's a fairly large question. It's about scaling. So thank you, Jill. Obviously, in terms of scaling approach to these issues into communities throughout Australia, are there any particular enabling conditions that are identified that help determine where to focus efforts? Like, what is it that you got, aha, that's a situation we need to focus there, or that's a situation we need to focus there, or don't you have anything in place to identify that?
I'll jump in with one condition. I think it's leadership, small L leadership. So quite often when we look at where there's a natural, like a natural compassionate community network that's kind of popped up, I met with three people who are launching their own compassionate community network in South Australia last week. And I asked them, so what's your story? Why are you guys doing this? And as soon as they started sharing, I went, that's the enabling condition. So these are women who are 65, who have had professional lives, who know that they've got another 30 years to go. They've done a little bit of caring with one or two loved ones. They've developed their death literacy, and they totally understand what it means to be a community person and a death literate person. And they're essentially activists. They want to put their money where their mouth is. So that's really exciting. So I think there's always capacity for leadership, but when you can see that leadership already there, those green shoots, then it's just about empowering people, backing people, and creating that sort of fellowship. So it's a shared experience. Samar?
Yeah, certainly. Look, I mean, it's been carried by volunteers so far and leaders in their communities, and it needs to be like this. But we really need more government support. With 100% of us are going to die, like there is no question about that. This is like a global public health issue that, we can't keep, saying it's not the government responsibility as well as the community. So I would really like to see more input from government, whatever levels they're at, to those very hardworking volunteers who are in this space.
Great way to end. Punctuation mark on that one. Look, thank you both. We are out of time. We probably could talk for hours, I'm sure, and I know there is some wonderful stuff coming through on the chat. We will make sure that those questions get through to you. A couple of people have asked to reach out to directly to help obviously amplify the work that you're doing. So we'll make sure all of that goes through. So to Yvonne and to Claire and to all of the Narelle, thank you so much. We will make sure that all of that gets through to our speakers today. And to Catherine, thank you. There's too many, I can't name you all. But I do need to wrap it up. It is really great that as a small organisation, we can bring this great Inspiring Australians online Lunch with Leaders series to the community. And it's not just the West Australian community. We have people joining from all over the country. And and from time to time internationally, depending on the time zone that they're in. So thank you very much, so much, to everyone that does take the time and to join us. There are lots and lots of initiatives like this that my small team curates during the year with respect to our Australian of the Year alumni. And we love the work that we do with schools and local communities to promote inclusion and social cohesion and obviously leadership in these sorts of spaces, and particular civics and citizenship through our capacity building program. So please do jump onto the website, have a look at some of the other stuff that we're doing in this space. We would love to get your feedback, get you involved. And if you've got any questions at all, or you want to reach out, or you want to do some training with us, please do connect. We look forward to hearing from you. A big thank you to our amazing speakers today, Samar and Jessie, for your time and of course your passion. It is so important that we take these opportunities to celebrate our successes, but also have the platforms to talk about how we can be better. And this is an absolutely important space. And your work in particular for this community work is absolutely respected, and we thank you for that. And also to the people joining us, thank you for taking the time out of your day to join us to hear from our speakers. Remember, next week, Dying to Know You Day, it's the 8th of August, so do visit the website and make a plan for how you can get involved. We are really keen to see if we can, sort of punch into this and see if we can make a bit of an impact after the work that we've shared with you today. So please do check out the website. It was in the chat earlier, so yeah, so make sure you get in and have a look. We do welcome your feedback also on this event and similar events like this. So please do take a minute to scan the QR code that we're going to pop up onto the screen in a minute and complete the survey. It's always good for us to get better and learn from all of the feedback that we receive from our participants in these sorts of programs and initiatives. So do take the time to do that, and remember, we will send you the slide deck from today. So thank you again, everyone, for joining us. It's been an absolute pleasure to host today's session. It's been an absolute pleasure to host our WA 2023 Australian of the Year, Samar. And of course, Jessie, thank you so much for joining us. Everyone, have a really great afternoon.